Welcome back to KS Medical Coding Academy. This is day 12 of our 30-day CPC exam prep series. Today, we're diving into the musculoskeletal system, one of the most important parts of the surgery section. Let's get started. The captain code range for the musculoskeletal system is 20,000 to 29,999. This section includes procedures performed on bones, joints, muscles, tendons, and ligaments. It's heavily tested in the CPC exam, especially topics like fracture care, joint procedures, and casting. Let's break down fracture care. Closed treatment involves no incision, just casting, splinting, or manipulation. Open treatment requires a surgical incision. Percutaneous treatment uses instruments like pins or screws but doesn't fully expose the fracture. Watch out for initial versus subsequent care. This matters when selecting the correct code. Here are some high-yield captain codes: 20,005 for soft tissue abscess incision, 20,610 for arthrocentesis or joint aspiration, 27,096 for SI joint injection with image guidance. 27,506 is for open treatment of a femoral fracture. And 29,881 covers knee arthroscopy with meniscectomy. Make sure you understand the full procedural description for each of these. Casting, strapping and splints. These services can be reported separately, but only when they are not part of a surgical package. Remember to distinguish between application codes, supply codes, removal codes. Casting done post-operatively might not be separately billable. Always refer to captain guidelines. Captain book navigation tips. Here are a few tips. Tab the 2000-29999 code range. Use highlighters for fracture care codes, they're exam favorites. Clearly mark differences between open, closed, and percutaneous treatments. Read the surgical section guidelines at the beginning. They're golden during the exam. Real-world CPC scenario. Let's look at a practice case. A patient receives closed treatment of a right distal radius fracture with manipulation. No surgical incision is performed. Which code should we use? Answer: 25605, because it includes closed treatment with manipulation, without surgery. Practice quiz. Let's test your understanding with 5 quick CPC-style questions. Pause briefly after each for students to think. Arthrocentesis of the knee with aspiration, no ultrasound guidance? Answer: 20,610. Closed treatment of tibial shaft fracture without manipulation? Answer: 27,760. Application of a long arm cast, not part of a surgical procedure? Answer: 29,065. Open treatment of clavicle fracture with internal fixation? Answer: 23,520. SI joint injection with fluoroscopic guidance? Answer: 27,096. Summary and what's next? Today we covered a high-yield section, musculoskeletal, including fracture care, joint injections, and casting. Make sure to review captain instructions and modifiers where needed. In day 13, we'll move on to the respiratory system, covering nasal procedures, bronchoscopies, and thoracentesis. Stay consistent and keep coding.